As a licensed naturopathic doctor and board-certified biofeedback practitioner, I always talk to my patients about how nutrition, hydration, exercise, and sleep can affect their health. But the area where we probably spend the most amount of time is actually addressing stress. All of us have stressors or things that trigger us, right? And it's really not about that stressor, but about our stress response, which speaks to how we're orienting to our environment and the people around us. And really how our nervous system is orienting, because it's our nervous system that perceives and picks up on those signals well before we react or give them meaning. So why are the effects of stress so widespread? Because if you think about our nervous system, it's our nervous system that dictates all the rest of our internal organ function. So it tells the rest of the body how to function. And if it's out of balance, then other internal organ systems of the body will become out of balance. For example, we can have increased muscle tension or pain, right? Increased blood pressure. With chronic stress, we can have decreased immune system function or irregular painful periods for females, worsening digestive issues such as diarrhea, reflux, gas, as well as worsening fatigue, anxiety, and insomnia. So, why does this happen? We have two parts to our autonomic nervous system. The sympathetic, which is that fight or flight nervous system. If you hear a loud bang, or if we saw a bear in the woods, this is that part of the nervous system that would help you become activated and mobilized so that you could get away. This part of the nervous system developed and evolved to respond to acute physical emergencies. I perceive that I'm in danger, and this is that part of the nervous system that gets me to mobilize and fight or flee. And this part of the nervous system served us well in the past, and it helped us survive. But in today's modern society, we just don't have those same acute physical dangers that our ancestors had. But we still activate this part of the nervous system just thinking about our stressors, like our relationship, our bills, our boss, right? Our job, studying for an exam, driving on the highway. That list goes on, right? And just thinking about those things, we activate that part of the nervous system for way too long. Hours, days, months, even years. And I see this in many of my patients be the major contributory factor to their disease state. But it gets overlooked by conventional care. Conventional medical care really falls short in their approach in treating stress and anxiety because they try to manipulate neurotransmitter pathways by using different drugs like SSRIs, Prozac, Zoloft, Paxil, benzodiazepines like Valium, Xanax, Klonopin, as well as beta blockers, Buspar, which unfortunately do not treat the cause, and they come with a significant side effect profile. And the thing is that these stressors are unlikely to change. They're unlikely to go away on their own, right? But we can change our response to them with practice and training our nervous system to become more resilient to those stressors. So, how can we regulate this and bring balance to our body and our nervous system? That's where the other part of the autonomic nervous system comes into play, our parasympathetic nervous system. That's that rest and digest, rest and relax nervous system. And how we can largely impact this part of the nervous system and bring balance to it is actually through the breath. And it sounds so simple, but nearly all of my patients who start biofeedback training need to be retrained on how to breathe functionally to impact their nervous system. Why? Because most of us breathe dysfunctionally and tend to be chronic hyperventilators or overbreathers. Now, chronic hyperventilation is different from acute hyperventilation, which is seen in panic attacks, that very rapid breathing, right? And chronic hyperventilation looks a number of different ways. It can look like holding your breath, taking a deep breath in and holding it. It can look like frequent sighing or frequent yawning. And chronically hyperventilating after just 3 minutes can decrease oxygen to the brain and to the heart by 30%, which affects our cognition. I have patients tell me all the time, Doc, I'm having issues concentrating, or I can't focus. I've been forgetting things. My memory's been bad lately. But if we're in that sympathetic nervous system response and we're chronically hyperventilating, we're going to get stuck in our amygdala, which is that classic fear center of the brain. And we're not going to be able to go into our prefrontal cortex, which is where we have executive function, things like focus, concentration, and memory. So, as you can see, breathing actually largely impacts our cognitive function and our ability to perform. our breath is also directly connected to our parasympathetic nervous system through the diaphragm. The diaphragm is that large dome-shaped muscle that sits on top of the abdominal organs right underneath the rib cage, and we activate the diaphragm using belly breathing, and we engage that parasympathetic nervous system via the vagus nerve, which is cranial nerve number 10. It starts up here in the brainstem, it goes down through the neck, through the chest where it connects to the heart, and into the abdomen where it connects directly to the diaphragm. And when we practice slow-paced diaphragmatic breathing, we exercise that vagus nerve, just like any other muscle in the body. When we breathe at that slow pace, diaphragmatically, we exercise that vagus nerve, and we actually build resiliency into the nervous system because of that training. Another way that we build physiological resiliency into the nervous system is through what's called the baroreceptors, which are these pressure sensors or stretch sensors. And they're located in the carotid sinus in the neck, the aorta, and the chambers of the heart. And these baroreceptors respond to pressure changes in the blood vessels. And they become activated when we breathe at a slower pace, in the range of 4.5 to 6.5 breaths a minute. Now, a conventional physiology textbook will tell you that a normal breath rate is somewhere between 12 to 20 breaths a minute. But for the purposes of biofeedback training, that's considered over-breathing. Now, in the range of 4.5 to 6.5 breaths a minute, we activate those baroreceptors, and two things happen. First, it lowers our respiratory drive at baseline. So you have a resting breaths per minute before biofeedback training, and after you've been training breathing at a slow pace, activating those baroreceptors, your resting breaths per minute at baseline decreases. So you're in a parasympathetic nervous system range at rest, which is where you should be because you're just sitting here. Now, the second thing is that baroreceptor activation actually inhibits sympathetic nervous system function, thereby increasing parasympathetic function. And over time, with training, your nervous system becomes more resilient to stressors and more adaptable. Now, again, I'm a naturopathic doctor, so I believe in effectively treating the cause of disease and illness. And in the case of an overactive sympathetic nervous system, in the case of stress and anxiety, this is how we effectively address and treat the cause. Now, another thing that I personally use in my patients' treatment plans to treat the cause and build more resiliency is something called emotional desensitization. So, once the patient gets good at functionally breathing, we retrain their breath effectively, we start to introduce stressors. So I'll say, get into the breathing, get into parasympathetic nervous system function. Now, think about a stressor, but stay in that parasympathetic nervous system function. And that's hard for patients. So I'll say, okay, get back into parasympathetic using the breath. Now, think about that stressor again. And so when we continue to go back and forth, and I use several different techniques on top of that, but at the end, once they get it, they've become emotionally desensitized to their stressors. So an additional way that we build resiliency into the nervous system. Now, there's other ways to address stress and anxiety, such as through supplementation, things like L-theanine, GABA, taurine, and glycine, different herbal adaptogenic herbs like rhodiola, ashwagandha, ginseng, or different nervine relaxing herbs like lemon balm, passion flower, poppy, kava, pedicularis, hops. But the only way to truly treat the cause of an overactive nervous system is using the breath to create balance and resiliency. And remember, the goal of biofeedback training is to be able to self-regulate in any situation, no matter what arises, and find new ways to orient to our environment that actually serve us. So, if you're interested in learning more about biofeedback or naturopathic medicine and would like to set up a free consult to discuss your health concerns with me and see how I might be able to help you, please click below and send me a message. Or we can also set up a brief phone conversation to get your questions answered. So thank you very much for watching and have a great day.